Hi, Jody.
Hello.
Well, Jody, I know that we've talked about the fact that there's an aneurysm. We talked about the different alternatives for treating it, and I think the best way to go is going to involve a craniotomy, opening the skull and going in and closing the aneurysm off. I know you had some anxiety about it. We have the ability now to show you exactly what we're going to see during the surgery. This is a virtual reality headset, and this is going to give you a view as if you are seeing the aneurysm as we will in the operating room, and in fact, even better. We have diagrammed this three-dimensional reconstruction of your anatomy, exactly where the opening is going to be. It just looks straight in the hole, right up to the aneurysm. And if you turn around,
Oh, there's the back.
this right here is the view that no surgeon will ever get. This is the view from inside the head out. We're essentially rehearsing the operation now, so it gives me a tremendous sense of confidence before we go ahead with the surgery. So we'll clip the aneurysm, that will seal it permanently, and there'll be no cosmetic evidence that we were ever there once you heal up.
It helps a lot to be able to see what
Doesn't
that looks
it?
like.
Yeah.
I couldn't picture it before.
Okay, I think we're ready for the surgery.
Thank you so much, Dr. Martin.
You're welcome. Okay, Alex, we got a tough skull-base tumor here. I wanted to go over this with you so that you get a view of what the challenges are. So you can see the tumor here on the axial image. The coronal image here doesn't entirely clarify where the carotid is. We just don't see it clearly enough, so let's take a look at it in VR here.
Okay.
I've got a full 3D view, and there's a carotid artery. We're right on it, and I can see exactly where it's coming out of the tumor right there. So this reconstruction is created from medical imaging like MRI and CT scans. So the flat planes are stacked, turned into a three-dimensional model, and then fed into the system so I can look at it from every possible angle. So I can get down below it and look up, come off to the side, and fly right back in and see it from this unique angle here and burn it into my brain. A tremendous sense of deja vu when I get to the operating room. So Alex, let's have you take a look.
Thank you. Wow.
So I'm going to fly you inside. If you look down towards your feet, there's a ventricular system in blue.
Peek around the corner. It's that lateral ventricle.
Okay, Alex, I got to go check on the class now. We're going to evaluate this tumor with a group of the younger residents. Why don't you come with me? So guys, we're going to take a look at a skull-base tumor here today. So let's have everybody put on their Oculus headset, and we're going to take a look at this reconstruction. All right, the superficial temporal artery is on the right, and take a look off to the left. We're going to see the skull-base tumor here.
Relationship to the sphenoid wing there. You can see the ACA coming over. Even better view than the OR.
So this allows us to go through the anatomy of very complicated brain tumors and brain aneurysms with the residents. They'll have an intimate knowledge of the anatomy of some of the most classic kinds of neurosurgical problems. Not only do you get an incredible three-dimensional view, but you also get a memorable experience that really stays with you when you go into the operating room. You feel like you've been through the territory before. Okay, well, I think that's a great experience in a complicated tumor. We'll see that in the operating room soon. We've got another case in the operating room now, and we're going to head over to the Reagan Hospital to take a look. Okay, let's take a look at the case. So what we have is a lesion in the left temporal lobe. You can see the motor fibers here, the corticospinal tract, going right by that temporal lobe lesion. The two-dimensional images here are just not giving us all of the spatial relationships that I'd like to see. So we're going to take a look at this on the surgical theater snap. Here we're seeing a skull-base meningioma, and what I want to do is fly right to the other side of the skull. There's a view of the carotid artery right there coming out. You see that? So I'm going to have to fly all the way past it, turn around and see it from this angle. That is extraordinarily useful. Alex, take a look here. You can see your perspective here. Fly right up to the tumor. You got a great view of the tumor there. You're right next to it, obviously. We can zoom right in here. And there's our carotid right there.
There it is.
I think we got the anatomy down. Let's go scrub in and get ready to go.